Hey guys, Dr. Nick here from Health Source Chiropractic. We're talking about our health tip of the week, and this week we're talking about shoulder dislocations. And I can personally tell you these are not very fun. I've dislocated my shoulder more often than I care to admit, and at the end of the day, it causes a lot of issues, not so much in the shoulder itself, but in the musculature around the shoulder. So a shoulder dislocation is when literally your arm gets pushed out of the socket of the shoulder. A lot of times it can go up or it can go down and back as well, which you can imagine puts a lot of strain and stress on these muscles, kind of like a piece of saran wrap. When a muscle gets stretched, just like a piece of saran wrap, we pull it and we stretch it, it never comes back to that nice little square that we started with, or the nice normal muscle. This leads to a lot of scar tissue, it leads to a lot of muscle tension, can even lead to some restriction in range of motion, especially the first couple weeks. So we have to get in and stretch the shoulder. We have to help with the scar tissue to break it up, to allow the mobility to come back where it needs to be. Shoulder dislocations are not a fun injury, but I want to tell you that there's a lot of things that we can do to help, and I'm living proof that shoulder mobility and motion can be returned even after 3 surgeries. So at the end of the day, if you have questions, if you've had a shoulder dislocation or you continue to have a shoulder dislocation, call our office to figure out how we can help. 882-3726. That's our health tip of the week here at Health Source.